friends, today we are preparing medication from ampule. Steps. First of all, we will wash hands and put on gloves. Step 2. Check medication order and compare it with flow sheet. Check prepare medication ticket. Step 4. Collect equipments. Step 4. Check for expiry date and any changes in color, consistency, etc. Step 5. Calculate the dosage. Step 6. Take top of the ampule lightly with finger until fluid leaves it. 7. Wrap small gauze piece around the neck of ampule. 8. Snip of ampule bending it towards you. Step 9. Insert syringe needle into center of ampule opening. Step 10. To expel excess air bubble, remove needle from ampule. Hold syringe with needle pointing up. Step 11. If syringe contain excess fluid, use kidney dish. Hold syringe vertically with needle tip up and slanted towards kidney dish. Slow eject excess fluid into kidney dish. Recheck fluid level in syringe by holding it vertically. After preparing medication that we will inject it in the cannula, but before cover needle on syringe with cap, change needle on syringe. Start medication. After the medication, discard the ampules and its top into soft container. Replace equipment and wash hands.